Can you remember the entire thyroid hormone chapter using just one single flow chart and few memory tricks? Most MBBS students try to memorize dozens of pages before exams, but toppers remember only few visual diagrams. In this video, I am going to convert the entire thyroid hormone chapter into 8 handwritten memory pages that you will remember even inside the examination hall. Don't miss the last slide because I am going to combine the entire chapter into one single master diagram that can help you recall the whole answer in under 30 seconds. Before learning the details, always see the big picture. Everything in this chapter revolves around just 6 ideas: functional anatomy, biosynthesis, regulation, actions and functions, clinical, and investigations and drugs. If you can remember these 6 branches, you have already remembered the entire university answer. Now pause this video. Can you recall all the 6 branches without looking? If yes, you are already ahead of most of the students. Let's simplify the gland and the hormone. First, about the anatomy. Thyroid gland is the largest endocrine gland, about 15 to 25 gram, and it is highly vascular. Think of thyroid as a small factory. Here, the follicular cells secrete T3 and T4, whereas parafollicular cells or C cells secrete calcitonin. These follicular cells show shape changes depending upon the activity. Inactive cells are flat shape, whereas highly active become columnar. Now about the hormone. See here, T4 is produced more amount, that is 90% of the output. It acts as a prohormone, whereas T3 producing 10% was most active at the tissue level. We can remember like this: T4 is the storage tank, huge amount inactive, whereas T3 is a sports car engine, small amount but incredibly potent. 40% of the T4 is converted into T3 in peripheral tissue. A single flow chart can fetch several marks in university exam. Instead of remembering paragraphs, remember only 6 words: trapping, thyroglobulin synthesis, oxidation, organification, coupling, storage, and release. One peculiarity of about the thyroid gland is the hormones are stored in the choroid cavity and not in the cells. If you want to remember the entire process, remember only one single sentence. That is, I only organize couples so regularly. Once this sentence is fixed, the entire synthesis becomes easy. Now let's remember the regulation. Here, hypothalamus starts the process. It releases thyrotropic releasing hormones stimulated by cold and stress, which act on antipituitary gland and which releases thyroid stimulating hormone. It increases the cell size and synthesis of thyroid hormone. And once the thyroid hormone levels becomes high, they switch off the hypothalamus and pituitary through negative feedback effect. Remember, the massive doses of iodine paradoxically blocks hormone release. This clinical condition is called as Wolff-Chaikoff effect. This page answers one simple question: what happens if thyroid hormone increases? The answer is everything speeds up. It increases basal metabolic rate and oxygen consumption because it is having calorigenic action. The other actions include: on CVS, it causes tachycardia, increased cardiac output, and increased pulse pressure. On CNS, it is crucial for normal myelination in the first year of life, enhances wakefulness and fast reflexes. For GIT, it increases appetite and motility. For respiration, it increases ventilation. And for metabolism, it causes lipolysis and increased carbohydrate absorption. In excess, it causes protein catabolism. Remember, think of thyroid hormone as body's accelerator pedal. Press accelerator, everything runs faster. Student, remember this analogy for years. This is probably the easiest slide. Don't memorize, just compare between hyperthyroidism and hypothyroidism based on these factors: BMR and temperature. Here, both increases, the person becomes heat intolerant. In hypothyroidism, both decreases, the person becomes cold intolerant. Weight, there is a weight loss in hyper, weight gain in hypo. Heart shows tachycardia in hyper, whereas bradycardia in hypo. Skin becomes sweaty and moist in hyper. It becomes a dry, thick, toad skin in hypo. And CNS shows restless and tremors in hyperthyroidism and lethargic and slow reflexes in hypothyroidism. The example of hyperthyroidism is Graves' disease. It is an autoimmune disease where antibodies mimic thyroid stimulating hormone. The signs include exophthalmos and goiter. The example of hypothyroidism is myxedema in adult, whereas cretinism in infant. It is an untreated congenital hypothyroidism, causes mental retardation and stunted growth. Now let's revise the favorite Viva question. What is the best screening test? TSH level is the best screening test. How does T3 actually works inside the cell? T3 act directly on the DNA, bind to thyroid response element in the nucleus, and transcribe mRNA. What is the difference between action of catecholamine and thyroxine? Both increases BMR and heart rate, but catecholamine action is rapid and short, whereas thyroxine action is slow and for long duration. Now about the antithyroid drugs. What are the drugs which blocks trapping? Thiocyanate perchlorate. What are the drugs which blocks oxidation by peroxidase? Carbimazole and thiouracil. Try answering these questions before I reveal them. It prepares you for Viva. See the slide I want you to remember forever. Close your textbook. Look at only this diagram. Everything starts with the hypothalamus. Hypothalamus releases thyrotropic releasing hormone which act on antipituitary gland, which in turn secretes thyroid stimulating hormone, which stimulate the thyroid and causes release of T4 which is stored and T3 which is more active. Now this T3 shows three prominent actions. First one, it produces negative feedback effect, inhibit TSH and TRH. Second, it enters the cell nucleus, binds DNA, and increases protein and enzyme synthesis and activates sodium potassium ATPase pump. And third one, it produces systemic fire, that is, it increases BMR, heart rate, CNS growth, and heat production. Always revise this page before entering the examination hall. I promise your recall will become much easier. If these handwritten memory notes help you remember the chapter, save this video and watch it once before every exam. To complete the full learning cycle, watch the other two videos in this series. Main video, learn the complete 10 marks university answer, and rapid revision, revise the chapter in just 5 minutes. And if you enjoy topper style handwritten notes and exam focused physiology, subscribe to Physio with Neo because every topic on this channel follows one simple system: learn, revise, and remember. See you in the next memory video.